Welcome to the Health Fix podcast, where health junkies get their weekly fix of tips, tools, and techniques to have limitless energy, sharp minds, and fit physiques for life. Hey, health junkies. On this episode of the Health Fix podcast, I'm interviewing Dr. Alan J Bauman. He is a hair transplant surgery specialist in Boca Raton, Florida, with over 28 years of experience in the medical field and quite a bit of it in the hair restoration realm. He's won awards. He's definitely pioneered some new treatment therapies, and he is a guru in the hair restoration and transplant surgery department. And in this podcast, I learned a ton, and I have no doubt that you are going to as well. Because, if your hair is receding, if you're losing your hair, you're worried about your hair, this can have a huge impact on your confidence and your self-esteem. In this episode, we are going to talk all about things hair. So let's introduce you to Dr. Alan J Bauman. Hey, health junkies. I have Dr. Alan Bauman on, and I laugh because he gave me the best way to describe this. When you bow forward, we can see what's going on with your hair. And of course, today we are going to be talking about hair loss and what you can do about it, because I think this is one of the really big things that affects our mental health and our emotional health and our confidence. And we got to talk about it. So Dr. Alan Bauman, welcome to the Health Fix podcast.
Thank you so much. It's a pleasure to be here with you.
Well, I've enjoyed chatting with you already. We've had some great laughs just to get started. So I have no doubt that we are going to have a fun time here on the podcast. So hair loss, my goodness, a couple of things that I think about, and something that you brought up right off the bat, is that women's hair loss is different from men's hair loss. And so I want to jump into that, because I think for a lot of us, we start to think there's this, okay, we've got the shampoos, we've got the different hair treatments, we have these different options, but where do we go? How do we navigate it? So let's first talk about the difference between men and women when it comes to hair loss.
Yeah. So, well, first of all, hair is important for both men and women, although men have some more, let's just say, socially acceptable options. If they're losing their hair, sometimes they decide to shave it and embrace it. That's a little bit less popular. For the female persuasion, the crowning glory is important. It's kind of hardwired into our brain that hair is a sign of youth and vitality, and of course, fertility. It's an outward sign of our age. And so it's natural. It's embedded in our lizard brain. If we want to try to propagate the species, we're going to make a snap judgment whether that thing, person, or whatever is across the room or is a good mate for us. So that's why hair is so important. But when hair loss occurs, it looks different in men and women. And you're absolutely right. We can see hair loss in men usually very quickly. Their hairline starts to recede. Maybe they have a little thinning on top, and they actually go bald in those areas. Baldness in women is a little bit less common. The most traditional causes of hair loss are genetic. And genetic hair loss in women occurs a little bit differently. Yes, it's in the frontal zone, but they don't really recede the hairline too much in the beginning. They typically lose volume first and coverage. So it looks a little bit thin. The part line gets a little bit wider. They have to change their hairstyle a little bit. Eventually, yeah, sure, you can get a little bit of a recession. The forehead seems to grow, but it's really the hairline shifting back. And women typically see more shedding. They complain of that more often. They typically see changes in their hair texture and the shine, for example, and the way they have to manage their hair changes as they age, and the hair caliber changes. So there's a lot of different things that can really go wrong with that tiny little hair follicle that you've got under there. And hopefully you start out with about 150,000 of them on your head. And we want to try to keep and preserve every one and make them grow at full tilt. So hopefully that's what we'll chat about today.
Oh, absolutely. Absolutely. I mean, obviously you have wonderful looking hair. And for those of you guys, when I do the short clips, you'll see what he's working with here. I mean, it's amazing. I looked at it right away. I was like, wow, you've got some great hair. Now, you shared with me that you also had some struggles with your hair, and that's why you're here. Tell us a little bit about your struggles as a man and kind of how they kind of fit into some of the clients you see as well.
Sure. So I guess, my dad went bald when I was a teenager, and I watched him lose his hair, and he worked from a comb over to lotions and potions to eventually wearing a hairpiece until I got the chance to transplant him years later after I completed my training and opened up my practice. And so we were able to restore his full head of hair. Now, his dad, my grandfather, I don't remember him ever having hair. I figured he was just born bald, and so, and also on my mom's side, my mom's dad also had severe hair loss, even before he passed. And so, I figured this was coming my way one way or another. I just assumed that eventually I'd be losing my hair. And I always loved my hair. I grew it long when I was in medical school. I try to play bass by ear, and was, in a small little band with medical students and such. But I always loved my hair, and I had it in a ponytail for a number of years way back when. It was not a man bun, but it was a little ponytail. But what I learned over the years, obviously getting into the field of hair restoration, and that's a whole separate story if you want to hear that, is that there's ways to protect and enhance your existing hair. And so I've been on therapies and treatments for over 2 decades. I'm a hair junkie, so I've tried just about everything, but I've used the FDA approved medications. I've used red light therapy. I've used my own nutritional and nutraceutical products that I developed, a whole line of them, actually. I've developed my own hair care products specifically for myself and for my patients as well. So I have not yet had a hair transplant, although eventually I'll probably need one.
Wow.
Yeah, but it's been an amazing journey. I do monitor my hair, like, on a regular basis, at least twice a year. I do measurements, and I encourage my patients who are struggling with hair loss to come in for measurements as soon as they possibly think that they might have some thinning, or if they think that they're at risk for some thinning, because that's the best way to get some early detection done, to know exactly what's going on at the level of the scalp before it's noticeable to the naked eye.
Absolutely. I'm fascinated. I didn't know you can measure your hair other than the old school thing that us gals do. We put our hair in the ponytail and we see how many rubber bands we can turn around there. And if it gets less, we panic. So tell us how, okay. And I also want to know what the name of your band was with the medical students, because
I don't even think we had a name. I don't even know if we had a name. I have to think about it. But
oh
you're
my
right.
God. That's hilarious. But no, how do you measure hair? Like,
Yeah.
what do you do? Tell us.
So what's interesting, what you just described, measuring your own ponytail volume actually is one of the most common ways that women detect that they're losing their hair, because they're literally inventorying their hair multiple times a day. And this is something that's been scientifically shown through surveys that women check their hair, like 24 times during the day. Whereas men, we're lucky if we check it once in the mirror, while it's dark in the bathroom, before we leave the house. But what happens is that the same technology, what you just mentioned, is measuring a cross-sectional bundle of hair, actually became the basis of a tool called Hair Check, which is something we've been using in the practice for over 15 years. And we've done over 100,000 of these measurements easily. And what it does is it measures in different locations on the scalp this cross-sectional bundle in a 2 by 2 centimeter area, which is about the size of a postage stamp. And it measures the cross-sectional area about a half an inch off the scalp. And so it's a very sensitive measurement of how much hair density you have, meaning the numbers of hairs, and also the quality of that hair over time. So diagnostically, most people preserve the hair around the sides and the back of their scalp, unless they're torturing it with hair extensions or something like that. And the areas up in the front, let's say, are going to be more susceptible. So differences between the measurements from back to front, essentially, give us a percentage of hair loss. And that becomes a basis for some diagnosis. But then also over time, if we start a therapy or treatment, we can track those changes, which areas are responding to therapy or not, by doing a repeat measurement after an appropriate interval of time. Usually about 90 days would be the optimum time to measure whether you're responding to a therapy. So Hair Check has been a part of my practice for many, many years. It's so simple and easy. We've taught doctors how to do it. We've taught their nurses and medical assistants how to do it. I've taught beauty professionals how to do it. Because it also is a good measurement for hair breakage and such. So cosmetologists can actually use this tool through training. We do a hair coach certification program to give them some background and guidance and hands-on with this tool, which is not even super expensive. I mean, it's relatively inexpensive to use. But brand new, great news. I've got an exciting new tool in the practice here at Bauman Medical. We use an AI-powered microscope to actually do hair measurements now. So this is a more sophisticated way, in combination with the Hair Check that I just described, to take a picture microscopically of the scalp, send it up to the cloud. It comes back with a hair count, so it counts every single hair, and it measures the thickness of each individual hair and gives you a graphical representation in terms of colors based on the hair caliber size. So we can see whether the hairs are there or not, and what quality they are. And that's really important for male and female pattern hair loss, because a hair follicle is not like a light switch that turns on and off. It's more like a dimmer switch that has a lot of variation in between. So before the hair follicle's dead and gone, it's working like sputtering. It's weak, it's thin, it's wispy hair. And so you can pick up those changes very, very carefully and sensitively with the AI powered microscope. And that's called hair metrics. And it's a super exciting tool. It's really cool.
Wow. I'm fascinated. I'm fascinated because I mean, obviously you mentioned with like the hair follicle, it becoming a little bit more wispy, losing kind of some of its punch. And you know, obviously this is something that a lot of folks aren't thinking about, and also thinking about what kind of damage they're doing. You mentioned hair torture with extensions. I'm also thinking about the different braiding. I'm thinking about the different for example, going out on a jet ski and not pulling, you know, putting your hair back under a hat and all the little breakage that happens. Tell us, like, how do you challenge a hair follicle to have damage? And then give us the scoop on, like, I mean, this is probably like 8-part question, but I want to know the scoop on like how do we strengthen this hair follicle business? So
how we fix it.
Yeah.
So
yeah.
there are so let's just separate first, like the part of the hair that's under the scalp. That's the living and growing, highly metabolic organ, the hair follicle. It's one of the most highly mitotic cell populations in the body. So what that means is it's undergoing cell division at a rapid pace. It's using a lot of energy to make the hair fiber. Now, the hair fiber is what you see. That's what's on your head. That's what you style from the outside. And the hair fiber has characteristics like length, right? How long your hair is, ponytail or short bob. Or is it thick, meaning is it a very coarse hair like an oak tree in a forest, or is it kind of thinner like a birch tree? And then also, is it pigmented or not? And all of these things, or even, and also curl, right? So is it straight? Is it curly? So all of those factors are genetically determined initially, as well as the thinning process that might happen over time. So if you torture the hair fiber itself with like chemicals and heat and sun exposure, you know, you can break down the fiber, the cuticle of the fiber, which is the protective layer, and that destroys the hair's aesthetic value, because then it becomes less shiny, it becomes dull looking, it becomes rough, it's not smooth anymore. And it becomes less resilient to changes in moisture. So it becomes more prone to breakage when you're styling it. So that actually, you know, once you damage the hair fiber, right, through these, you know, extrinsic things, it doesn't self-repair. I mean, you could try to kind of modulate it a little bit with conditioners and coatings and sprays and things like that, but you can never really repair the cuticle. So that's why it's really important to grow good hair from the get-go, meaning that you want to preserve the function of the follicle. Think of the follicle like a 3D printer making a little strand of hair. That's what the follicle is doing. It cycles on and it cycles off, and hopefully it cycles on and cycles off normally. But if it doesn't, that's when you get this miniaturization, this weakening effect. You get a thinner, wispier hair, and then eventually the follicle kind of peters out and it basically just dies, and it's beyond repair. So there's a lot of things that affect the follicle from the inside. The intrinsic factors, of course, age and heredity determine how your hair is going to respond just by, you know, living your life into the upper decades. But it's also a hormonally sensitive organ. And this is why women especially see shedding after childbirth, during perimenopause and menopause. It's also occurring during disorders of hormone dysregulation like PCOS. Hair follicles can really become dysregulated, and you can have a lot of hair loss during that situation. And there's so many other intrinsic things that could go wrong. Inflammation can shut down the follicle, poor circulation, poor nutrition, dysregulated sleep. So if your sleep-wake cycles are jet lagged or something, if everything is off with your circadian rhythm, you can really start to lose some hair too. So hair follicles are kind of a very holistic organ. That means it's like, it's also very sensitive, you know, because it's sensitive to all of these different things. And in order to treat hair loss, we've got to kind of take a holistic approach. We got to start from way back, you know, and take a good close look at what's going on just generally in your lifestyle and nutritional status and stress level and sleep wake cycles. And then, of course, getting into endocrine and, you know, biomarkers and, you know, blood levels of iron and everything from oxygen saturation to circulation to you name it. And so we look at all of that on top of the genetic tendencies towards male and female pattern hair loss. And that doesn't even scratch the surface to autoimmune conditions like alopecia areata and things like that. So what we're talking about today really is the primary cause of hair loss, which is hereditary, male and female pattern, androgenetic alopecia.
Mm-hmm. Mm-hmm. You've said so many things that, a lot of folks are probably like, really, Dr. Bauman, really? There's all these things. We've been marketed. Let's be honest. We've been marketed that we could totally repair our hair with different types of product. Let's call it that way. We've been told all these different things. And so now, of course, it's no surprise that when you tell us all of these different things we have to look at to figure out what's going on in the hair, it's like, have I been ruining my hair my whole life? And as a woman, you're thinking like, all my dyeing of my hair, all of the perms, all of that stuff. What would you say to a gal right now who's like, okay, I'm 45 years old and I'm starting to really notice some hair loss and thinning, and I've done all these torturous things to my hair and I haven't taken care of it, like you were saying with red light therapy and all this stuff. Am I screwed? Like, what do I do?
So the first thing I would say is let's take a deep breath, because the good news is that there's a lot that we can do. So, but what we don't want to do is we don't want to panic, and we don't want to get our blood pressure up, and we don't want to get that cortisol going, because hair is a very emotional organ, right? It causes emotion in the person that has it, and it can also trigger emotions in the observers, right? So I would say just the first thing is let's just hold on and not make any rash decisions. So don't go panic shopping on Amazon for some Miracle Grow shampoo or something. Let's start from the basics. So if I told my patients they can't color or style their hair, I would not be in business, and so I would have zero patients. And so we have to take that with the reality that styling our hair and chemically processing our hair, whether it's color, curl, and straightening and heat and all that, is going to be necessary to enhance its aesthetic value. But also, let's be mindful that we can't overdo it. If we have thinner, finer hair fibers, you're not going to chemically treat that hair the same way as if you had coarser, thicker, curlier hair. So, let's just be careful. And we also have to trust and choose our hair professionals very carefully, those who we trust to style our hair, and make sure that they're knowledgeable about our unique situation, which is the characteristics of our hair, and maybe even also what we might be at risk for. So, I mean, a lot of women do come to me and they say, oh my God, I got this last coloring treatment and, she fried my hair. And so we have to figure that out. Now, the good news is that you can get a haircut and you can grow more hair. But what are the things that we can do? What are the things we can do to evaluate the situation and modify the function of the hair follicle? Well, there's a lot. And so after looking at all of that kind of background information, taking into account the inventory of the allostatic load, which is everything that stresses us out, and our holistic lifestyle and nutrition and so forth, and our genetics, who in the family has hair loss and what exactly are the symptoms? What are you experiencing? Is it a thinning process? Is it a shedding phase that happens suddenly? That's called telogen effluvium. Do you have both female pattern or male pattern with the telogen effluvium? That was very common with COVID, actually.
Yeah.
So an illness or fever can trigger a telogen, a shed. And if you already have hereditary hair loss, well, that just accelerates the whole thing. Just like menopause and just like childbirth, sometimes the hair just doesn't rebound after an insult like that. And then patients have to come to me to figure out what to do to grow their hair thicker, better, stronger. Even vaccines, can dysregulate the immune system and can disrupt the microcirculation. And I have a lot of long haulers who are just dealing with chronic telogen shedding after shedding after shedding wave. And it's been years. And the good news, again, is that we can do some therapies and treatments to get it under control. So it all starts really with scalp health first. So that's kind of the basics. If your scalp is inflamed, is not healthy, is damaged in some way, we want to address that. And scalp symptoms range from oily or dry to flaky and irritated to pimply or bleeding. And we want to figure that out. I have an entire department, a trichology department. They don't ride tricycles. They do hair and scalp analysis. So trichology is like the paramedical version of an esthetician to a plastic surgeon. A trichologist works with hair restoration physicians like myself. And so we try to rectify that first. And then from the measurements and evaluations microscopically, we want to see if we're dealing with a density issue or a hair quality issue. And then we can get into good nutrition. As I said, the follicle is highly metabolic. So there may be some simple supplements or vitamins or herbs that we can use to try to get a control of the situation. And I always say there's thousands of vitamins out there on Amazon, but there are a few that have clinical trial, double-blind randomized studies behind them. And so we recommend those as well as the nutritional supplements that I've created. And some of it is fuel, like proteins and collagen powders. Some of it are specifically targeted things like ashwagandha for stress. And then other things are just kind of, basics like a good multivitamin for hair plus biotin, or dealing with other things that you might be working with, in terms of what's in your diet or not.
Mm-hmm.
So protein intake is obviously critical, and then making sure you're not anemic. Very common issues that we see in restrictive diets or weight loss diets, and Ozempic is certainly another topic that we can cover.
Yes.
That's triggering a lot of hair loss as well.
Oh my goodness. Oh my goodness. I love your holistic approach. I mean, it's incredible. I mean, you have thought of every single aspect of hair that one could, dang, it's impressive. It's impressive. I like it. And I'm thinking
it's like a foundation that we build on, right? So you have this, the foundational things like hair and scalp health. And we do that stuff first before we step into pharmaceutical treatments or red light therapy, regenerative treatments like PRP. And of course, if the follicle's dead and gone, then you're going to need a hair transplant for that area. But, you see what we do is we progress from the least invasive, safest things first, and then go from there. We get more aggressive as we need or want to.
Yeah. Yeah. No, that's huge. I'm kind of thinking, like, do you have stylists on staff that you consult with, or folks that you recommend? Because I'm thinking in my mind too, in terms of the whole process of, yes, you won't have business if you have women who are like, I want to keep dyeing my hair, but folks that you can communicate with what to do with products or things of that nature. Do you have lists of that? Do you have, because I'm just curious. I'm curious.
Oh, absolutely. So, like I said in the beginning of our conversation, we actually do a certification program called Hair Coach, which
cool.
There's a track for beauty professionals, and there's also a track for licensed medical professionals. And so sometimes we hold those classes together, but obviously the hands-on portion might be different.
Right.
What a beauty professional is doing in her chair might be different than what a nurse practitioner or a PA or a physician might be doing in their treatment chair. But they get a chance to see everything and get an idea of different perspective. But yeah, so we have men's stylists who are amazing at covering and styling men's hair loss and dealing with kind of the cosmetic downtime from a hair transplant or the interruptions in styling. And then we have female stylists who are partially trichology certified, and then they're hair coach certified. So yeah, there's a whole knowledge base out there that the beauty industry wants to know what to say and what to do about hair loss, and that interest is growing exponentially because during the pandemic we didn't have a chance to really do too many of those in office classes, in-person classes, and now there's just a lot of pent-up demand. So we just restarted that recently, and the class was sold out. So it's like it's the next one's going to be in a couple of months. So that's so that's like hairlossclass.com. That's one of the places that a lot of people go to kind of get the certified hair coach training.
Awesome. So guys, there's so many resources around this. This is awesome. You're like the one-stop shop for everything hair is what I can see here. Now tell us about the Ozempic. Tell us about what you're seeing there. I mean, the COVID long haul stuff with the telangium effluvium, that is awesome to hear that. I mean, tell us what you're seeing, because so many people, and I know we're getting into a shortage, so we might be ending up not seeing this as much in new cases, but the ones that are already there. Tell us, what is Ozempic doing? What are you seeing? What's happening?
So this is not new information. I mean, it may not necessarily be related to the drug itself, but let's be honest. If the drug is causing some weight loss, it's decreasing your ability to intake fuel or nutrients, causing you to lose weight, which is good. We want to encourage our entire community to lose weight. We're all, could probably lose a little bit as a general society. But here, the point is that if you lose a certain amount of weight and you're caloric restrictive, because the follicles are so highly metabolic, they're very, very sensitive to those nutrients and fuel. So follicles start shutting down. And so how did we know this was happening? Well, Certainly, bariatric surgery has been quite popular in recent years. Fad diets, dating back 20 years. And here in Boca Raton, Florida, even just like 10 years ago, we had this crazy thing called the cookie diet, where, I mean, it was basically a cookie made out of cardboard, I don't know, fiber or something. And people were
Oh.
eating this fiber cookie to try to lose weight. And patients were coming in after doing like eating cookies, I guess, for a week or whatever, they would lose how many pounds. So that was some type of caloric restriction, and but it was not a funny situation because they were losing a lot of hair because of it. And so bariatric patients, which lose a ton of weight in a short period of time, even though they're under nutritional guidance, the follicles, if they're sensitive, especially to female hair loss or male hair loss, wow, it can really start to shed. So we have a bunch of different types of therapies. Obviously, we don't want to refeed you to gain all the weight back, but we want to stabilize your nutritional status. And I have on board a functional medicine practitioner. I have a nutrition and fitness person. I have a medical assistant who's done hormone optimization. So I have a whole team of experts really in our what we call our performance program to help evaluate a lot of that, because we see so much of that dysregulation out there, not just Ozempic hair loss, but other weight loss issues and other metabolic issues, honestly, that we uncover when we have a hair loss problem.
Yeah, I mean, the hormones on top of all the other things. My goodness. I noticed you have the hair coach portal on your website. And so I was thinking to myself, like, they must have quite the coaching program for folks and coaching people down from some panic modes. I'm guessing too, from when they come in and don't know what's going on with their hair, because it is such a big deal. Now, tell us a little bit. You were mentioning more about the follicle, and you're mentioning in your case hair maintenance. Now, with your coaching programs, do you work with folks who are like, maybe they're like, I just don't want to end up like what happened to my mom, what happened to my dad. I want to prevent stuff. Maybe they're not noticing a ton of different changes, but they're like, man, I just don't want to go down one route or the other. Do you have a coaching program for that?
Well, I mean, look, the bottom line is if you have someone who is at risk for hair loss, if they're geographically suitable, they can come into the office here at Bauman Medical and get a consultation, get a measurement, get a baseline, and see what's going on. If it's really a minor situation, then maybe we just reevaluate in a year, see how it goes. Maybe we're doing just some basic things. If someone is not local or geographically near us, we can do consultations virtually. Now, of course, we're not going to be able to do that measurement, which is kind of cool,
Yeah.
but we're going to be able to determine what's going on, get a detailed history, get an idea of the symptoms, look at photos, look at them on the video, and see if there's any issues in terms of coverage. And we can start to guide them in terms of therapies and treatments that they can do. So becoming a patient of Bauman Medical is super simple. It's just from your home or your phone. You start at baumanmedical.com and you fill out some paperwork, and boom, you're going to automatically in the system. Now, there's a consultation fee, but it's only one fee for your whole life, and that's it. And then you're a patient for life. And so you can always reach out to us after that at no charge, essentially. And the measurements forever, at least for now, are no charge. You come in, get measured, and get evaluated. So, but therapies and treatments could start right away, aside from the scalp health issues and using the right hair care products and the right nutritionals and nutraceuticals. We might talk about, are you more, let's say, holistically minded and natural? Then maybe we're going in the realm of red light therapy for the scalp at home, or regenerative treatments in the office like PRP. We have another therapy called TED, transepidermal delivery. Or maybe we add some pharmaceutical intervention like minoxidil. Minoxidil is the old Rogaine topically, but now it's available compounded, so it's not as greasy or gooey, and it's a lot less irritating. And there are other topicals that people could use, and especially postmenopausal women could use, that are even a little bit stronger than that. And we can now also use minoxidil orally, so we can put that drug into a capsule at a microdose and trigger a lot of hair growth.
That's cool. I didn't know about that. And TED, tell us about TED. I want to know about this.
Oh, TED is an amazing technology. Transepidermal delivery of growth factors and peptides is something that we helped launch here at Bauman Medical. We were one of the first few doctors outside of the clinical trial work that happened in the Chicago area to be able to be qualified to provide this technology and treatment to our patients. And so PRP, you've probably heard of, is an injectable thing that you make from the blood, right? Blood platelets. Well, TED requires no needles, no anesthetic whatsoever, no blood draw. It uses a technology called sonophoresis. So sonophoresis is ultrasound. And ultrasonic delivery systems have been around for decades, basically making the skin more permeable. So the skin does its job pretty good. You get out of the shower, you're not swollen up like a sponge, right? Why? Because your skin is moisture proof, essentially, at least mostly. And it takes a lot to get through the skin, which is one of the reasons why we have to inject things. The skin is pretty good at keeping stuff out. Certain size molecules actually have a really difficult time getting through the skin. But sonophoresis, using ultrasonic sound waves, breaks up the stratum corneum, which is this very thin layer in the skin superficially that has typically a brick and mortar structure. So it's a very tight structure that keeps the water out, but this ultrasound kind of dysregulates it temporarily. And then this device called TED pushes the serum, whether with growth factors and peptides, right through the skin during the same visit. So you prime the skin with the ultrasound, you apply the serum, and then you drive it through with this technology. And what happens is that this serum, which is very powerful, it has, like I said, growth factors and peptides. It has everything from copper peptide to thymosin beta-4 derivative. It also has growth factors like VEGF and FGF. These are powerful hair growth stimulators that we apply once a month for 4 months in a treatment that only takes about a half an hour or so.
Wow.
And
wow.
Yeah. So no pain, no discomfort. Like we say, no trauma, no drama. And you go home, let the serum soak in even more, and then you can shampoo the next day. But patients are seeing hair improvements, hair quality improvements, hair texture improvements, as well as hair growth. We're measuring very well with the microscope. And also we're seeing some repigmentation as well, which is super exciting.
Really? Really?
Yeah.
And what age ranges with repigmentation? How, like, what's the range?
Well, sometimes women have deep pigmentation, going gray, obviously, at an early age. And, through some scientific research, we've kind of figured this out within the industry that if you catch it early and the follicle is not totally going gray 100%, it's kind of sputtering and still a little bit, the pigment is working a little bit, you can rejuvenate that follicle and get it to grow a thicker, darker, stronger hair. And that's what we're seeing. It might be due to the copper peptide. There's a lot of talk about that, although the research is not 100% there yet, exactly what the mechanism is, but the copper peptide might be helpful. And so we see all ages. Women are doing very well, and men on the treatment if they have hair follicles in the zone, right? That's the caveat. And then what happens is that after the 4 months, some patients will just decide they're doing so well, they just want to make it part of their beauty regimen, and they'll come in once a month for the treatment. And then others will wait until they measure a droppage. So if they've gotten this improvement and then they're seeing a plateau phase, and then they're measuring again and it drops down, maybe before the end of the year they'll do another series of treatments with the TED.
It sounds amazing. So I'm kind of in my head going like, okay, we've got a lot of folks that'll just start to notice the gray, like within, like, oh, it's the last couple of months I've started to go gray. Those are like ideal folks is what I'm guessing for TED versus someone who's like, yeah, I've been gray for 15 years or something of that nature, or had like a stripe on the hair that's been gray for that long.
Yeah, that's what we're kind of seeing is that the folks that have kind of early stages of gray are the ones that are seeing some repigmentation. They don't need to, color as often. They're seeing rejuvenation in the color. And it's not every single time, obviously. And not every patient responds the same to any therapy or treatment for all the reasons we previously talked about. Everybody's, status holistically is different. But the patients generally are tolerating the TED very well. And one of the most common symptoms that gets addressed with the TED is the shedding. So it's really great. In fact, that's the first thing that usually patients will notice even before the hair regrowth is they'll see a decrease in shedding. So if they've had shedding from either COVID or childbirth, or for some other trauma like general anesthetic or something like that, they can certainly do the TED, and it's been really, really good to stop that shedding. And do that first, see that first before you get the hair growth coming in later on.
Oh, that's neat. That's neat. Because I mean, that is one of the things that a lot of women will come to me and say that they're shedding quite a bit. This is really, disconcerting, but there's no other major appearance of loss other than just the shedding. So
well, that they can see, remember, you can lose 50% of your hair without it being noticeable to the naked eye. So, that's the point at which you want to try to take action is the earliest possible time that you notice a symptom. And so maybe nothing heroic needs to be done, but at least get an inventory of what's going on. Do that ponytail volume,
Yeah. So I have a question about that, because
Yeah.
there's shedding and then there's excessive shedding.
Right.
I've heard multiple different stats on like what's too much shedding, what isn't. Can you
Yeah.
give us a parameter? Because I think for a lot of folks, obviously we shed during the day. That's natural to shed a little, but how much is too much, really?
Yeah. So let's start with the reason why you shed. As we mentioned earlier, the hair follicle cycles. So the hair follicle goes through these stages of hair production where you're growing the hair. And theoretically, that should last 5 to 7 years. And sometimes it lasts much longer. I mean, I have one of my surgical technicians has hair that grows, all the way down past her hips. And so her anagen phase, her growing phase is much longer than 5 or 7 years. It just keeps going and going. It doesn't stop. It's amazing. But the average person, 5 to 7 years, the follicle will then shut down and then degrade. Actually, it'll actually separate from the base, and the follicle will then release the hair as during this resting phase as the new hair is being produced. So that's about a 90-day cycle of resting that occurs, right? So anagen is the growing phase, and then catagen and telogen is the degradation, and then the resting, and it all turns on and cycles again. So if you have 150,000 hairs on your head, and let's say they're all working and healthy and doing great, but they're cycling, a normal head of hair is going to shed about 100 to 200 hairs per day. Now, how would you see that? Well, in order to see 100 to 200 hairs per day, you'd have to actually brush out your hair or shampoo it and keep track of it. If you had your hair in a ponytail for 2 days and you were a normal head of hair, when you take out that ponytail after 2 days, guess what? How many hairs would you see? It's shedding. Well, it would be double. It would be all the hairs that you shed yesterday and all the hairs that you shed today too. So the less you manage your hair, right? Like let's say you shampoo once a week. Well, that could by the time you're ready to shampoo and shower and brush your hair out, you could see 1,000 hairs. That's like enough to choke a cat. That's like, it's going to get clogged in the drain. So that's just normal shedding. So it depends upon how often you're shampooing and brushing and manipulating your hair, and obviously the length of your hair. And so most men have shorter hair. They don't even notice any shedding. The wind takes it away and that's it. They don't even notice that it's gone. But women with longer hair and men with longer hair are going to see that daily shed. So when the shedding is excessive, then you're going to get, meaning that more hair is shed than what's being reproduced, right? More hairs are turning off than turning on. And that's something that happens with male and female pattern hair loss, right? In different zones. You could have a depletion of hair because of the cycling that changes. The hairs grow for a shorter period of time. They're only making a thinner, weaker, wispier hair. They're not making a big, long hair anymore. It's much, much shorter. It's not giving any coverage. The hairline's receding in that way. You see these shorter hairs in the temples. And so when that's happening, it's a concerning problem, right? You're going to see, that the shedding could result in depletion of density and depletion of coverage. So the point is that you want to get at it early. That's the take-home message, right? So excessive shedding is when you're losing more than you're regrowing. And that the only way to figure that out is through microscope or, the AI-powered microscope or the hair check measurements, or visually you see the changes. Yeah. So all of that requires intervention. You need to get an appointment so that we can see what's going on. And the good news is that we can address it. If you're in the early stages, there's a lot of hope. We're going to get you to maintain what you have, and we're going to regrow your hair.
My goodness. Thanks for sharing that. Because in my mind, some folks do only wash their hair once a week. So that would make sense if you would see more then. So logistically, we have to think about that. But ultimately for me, I'm a data geek. I want to see what the data is. So yes, going in, getting that done and just really assessing it. So of course, some folks don't live in Florida, but nevertheless, I'm like, how can who doesn't want a Florida vacation? So do you have folks come to see you while on vacation and get things checked out? Give us a scoop of like how, I know you said if you have a phone, you could get started. What about just the screening and things like that? Can folks just pop in out of nowhere out of vacation and check out?
Well, the hair restoration vacation is something that's been around for a long time, since I started the practice over 25 years ago. That was actually one of the feature stories on CNN, where patients would come in from out of town and stay at the local high-end resort and they get a hair transplant or other treatments. 50% of my patients do come in from out of town. I'm listed as one of the top 20 in the world. So having that certification and designation certainly has attracted patients from all over. I've treated over 30,000 patients, as you probably mentioned to your listeners, and performed over 12,000, 13,000 hair transplants. So we do have patients from all over. And it all starts with that virtual consultation first. That way we can get a great inventory of what's going on. And we can tell you, hey, look, you can start to manage this on your own. Or, if you happen to be in the New York area, we do pop up there once a quarter, typically. So me or my team or both will be there, usually in the city, to do measurements and evaluations and execute the non-invasive treatments like PRP and such. We've also been at many of the biohacking conferences over the years.
Mhm.
So if you're a data geek and you might be a biohacker, when it comes to your health. And so we've demoed the TED and we've done measurements for folks who have met us there. We did a conference in Los Angeles and more recently in Orlando. And so we do kind of pop around, but most of our patients will start first on the website. There's over 1,000 pages of information that I've written personally, and start their journey there with myself or with my nurse practitioner or with my associate surgeon. There's a lot of great ways to get things started.
Awesome.
That's baumanmedical.com, by the way, baumanmedical.com.
Got it. We will make sure we keep putting that up there. Now, one thing I did want to ask about, because I am not familiar with all of the hair restoration, like what kind of criteria do we have to get into the level of you need hair restoration? And so I definitely want folks to hear a little bit from you about that level and what that looks like as a treatment and a process and staying in a resort. I was wanting you to mention that because I had seen that info. So yeah, give us a scoop.
Yeah, I mean, look, hair transplantation today is far different than how it was just 5 or 10 years ago. It's a highly refined process. It's comfortable. It's not moving plugs anymore. It's not going to look weird or unusual. So someone that needs a hair transplant is someone that has an area that's completely depleted of hair or mostly depleted of hair. And so for some women, they're born with a high hairline and they just want to change their hairline to more aesthetically frame their face just based on proportions. Like the same way people might want a chin implant or a cheek implant, some women want a lower hairline. If you have a very high hairline, in this day and age, I'm not talking about Queen Elizabeth's age, because obviously that was a different time and a different era where high hairlines were a sign of nobility. Today, a lower hairline is considered more aesthetically pleasing and it's more youthful. And I think that, Queen Elizabeth's era was probably just an anomaly. But the point is that a lot of women are born with a high hairline and they want to change it or densify it. And that's great. Those are great candidates for hair transplantation. As long as you come to someone who has an artistic approach. And so we're not going to create a little semicircle hairline on your head or, a flat line. That would be ridiculous. We're going to match the contour of a natural hairline shape, which includes whether you had a widow's peak or not, whether you had a receding hairline or not, or whether you had good temporal points. And so we'll recreate that for you. But for female pattern hair loss, sometimes what happens is, and especially in women who are sensitive to androgens, right? Because that's a main trigger for hair loss in both men and women. A woman, let's say, who's on hormone optimization therapy that might include testosterone, might notice that her hairline is receding a little bit. And it can look more masculine, less feminine, and that's not so good. And that's a genetic tendency. Not all women on testosterone have that issue, but that's one of the most common areas that we transplant women. So if you're tilted your head to the side and you're looking at your receding temples and you're thinking that that's looking worse, or you're combing it over with a little bit more hair these days, comb it back there and see what's going on. You might need to have treatment to protect that hair or transplantation to densify it. And so how hair transplants work. So under local anesthetic, we don't cut a strip anymore. We're well beyond that. We're taking each individual graft, as little as a single follicle at a time, from the back of the scalp. And however many we need, that's how many we're going to go get. We take those follicles out and then artistically implant them into the thinning or the balding area. So there's really a two-step process. The recipient site gets made in the recipient area, and then the graft is then implanted into that site. And so it's a long process. It's not a fast process. The whole procedure could take 6 or 8 hours, but you're sitting comfortably, relaxing in the chair, either on your side or on your belly or reclining. You're watching movies, listening to music. Your scalp is completely numb with local anesthetic, and we're working. We feed you lunch, and hopefully we don't have to feed you dinner. But we work and get the job done. And then the healing phase. People want to know, well, what's the downtime from this?
Yeah.
Am I going to be bruised? Probably not. Am I going to be swollen? Maybe. Are you going to get crusting? Yeah, for about a week. So it takes about 6 to 8 days to cosmetically recover from a hair transplant to the point where you can go out and nobody would know. And where we harvest the hair is hidden under your existing hair. So no one would ever see that. We don't take every single hair from a patch. We're only taking a small percentage of hair. So that layer is growing back to normal very quickly and is hidden within days. So the hair growth starts in about 4 to 5 months and it becomes visible to the naked eye around 6 months. And then the full result is a year. And don't forget, we can also do things like eyebrow transplantation, eyelash transplantation, and we can also cover scars from brow lifts and facelifts or injuries or trauma.
Fascinating. Fascinating. Yeah, I did read the eyelash one and I was thinking to myself, my goodness, this is fascinating. I'm imagining too, like post chemo, there could be some interesting kind of interventions as well that you have for folks too.
Sure. So the most highly metabolic cell populations in your body, right? Hair follicles, as we mentioned, your GI tract, your bone marrow, all that stuff gets really hit pretty hard when you're on chemotherapy. And that's really the reason why the hair follicles shut down during chemo. The good news is that for many patients, most patients, you're going to get regrowth. It's just going to take some time. So maybe something temporary. And we do temporary non-surgical hair restoration. We actually have hair pieces and wigs and weaves. We also do cranial prosthetics, which is more of a medical grade version of that for temporary loss, like chemotherapy patients. We also do things to try to recover the hair, to enhance the hair regrowth. So unfortunately, many women today who've undergone chemotherapy, they have permanent alopecia from the chemotherapy. And this is just awful because a lot of these young women in their 40s, treating with breast cancer, and whether it was the alternative to tamoxifen, which right now is escaping my mind, but there's it was a whole class action lawsuit that this thing was promoted without the knowledge of the side effects to the oncologists, and they were prescribing this chemotherapy, which triggered Taxotere. Taxotere was triggering permanent alopecia, post chemotherapy alopecia, and that's a terrible situation because sometimes there's no hair to transplant, and these women will need cranial prosthetics for the rest of their lives. It's awful. But if you're having just a traditional chemotherapy treatment and we fully expect it to regrow, then let's use red light therapy, low level laser light, like the laser cap. It's a great non-invasive treatment for anybody with some thinning hair to try to rejuvenate the follicles. Let's put some other treatments into play, like minoxidil, either topically or orally or both. And hit it with some PRP to stimulate the follicles, or even TED, as we mentioned previously. Yeah. Those are all great treatments. And then we'll do the regrowth and we'll see if there's any areas that are lagging behind. We'll have to figure out what we need to do to get those areas back into action.
I think that's a great plan for being proactive. A lot of people don't think about that there's much they can do. They just are like, all right, that's it. I'm going to lose my hair. Maybe it'll come back. Maybe it won't. Maybe it'll come back weird, so be it. But that's great to know that there are options for folks in this case. My goodness.
100%. And even if you're going to go under chemotherapy and you don't want to lose your hair, check with your oncologist about getting a cool cap, a cold cap, which kind of freezes the scalp. It's not something that we can do here at the office, but you can get them at home. Some of the oncology centers actually have those mechanical devices. So you just wear the cap. Obviously, the chemo is not getting to the scalp. So there's a little concern there by some oncologists. So check with your doctor if a cold cap would be appropriate for you if you're nervous about the results of hair loss from chemo.
I'm glad you mentioned that. Those penguin caps and such are interesting to me. I find them fascinating. So
yeah, they do work 100%. Yeah, they do work very well.
So cool. So cool. My goodness, so much, which of course you would. You have such an expertise, and this is awesome. This is more than I've ever known about hair in my entire life. So I can't wait to share this podcast. This is going to be a fascinating one. So BaumanMedical.com, folks, where you can get all of your information on all of the info related to hair care. I mean, this is prevention. This is like all the things, all the way up to restoration. I mean, every aspect of hair, you guys have got it covered. It's awesome. I'm really impressed and look forward to learning more about your practice and what you can do for my clients too.
Well, thank you so much. It's been great. And, I would just finish off by saying if there's somebody out there, a man or a woman, or somebody that you know or love or that person in the mirror that's dealing with a hair thinning situation. The good news is that there's a lot of therapies and treatments that we can prescribe and recommend to get you on the path of restoration. So there's a lot of hope. There's a lot of results. The technology is changing every 6 months, every year. There's something new, something different that's coming out that makes our results even better than they were before, and the procedures and processes more effective. So I encourage you to reach out to me if you're feeling like you've got some thinning hair. Like I said, if you know somebody who is, go ahead and share this podcast with them.
Definitely. Absolutely. Thanks again. I appreciate it.
It's my pleasure. Thanks so much for having me.
Love it. This is great stuff.
Hey, fellow health junkie, thanks for listening to the Health Fix podcast. If you enjoyed tuning in, please help support me to get the word out about the podcast. Subscribe, rate, and review, and just get that word out. Thanks again for listening.